We have CareWeb QI. Out of Panama, we use CareWeb QI and the static, and then I think we have chronic contact, chronic disease management, and then I think we have ambulatory, and then we have inpatient criteria that we use. So we're looking to get auto auth. And we like that. We've seen it, and that's one that we don't have, but we want. MCG guidelines are very easy to use. I mean, it's very easy to access what you're looking for. What you can get out of it are CPT codes if you need to put that in, or ICD-10 codes, and so sometimes we have to put those kinds of tracking in what we do in our medical records, and you can find them easily on MCG. What I like about MCG is it's pretty much it's very friendly to use. You can pop up the disease that you're looking at, and in particular like a hip replacement, and you can look at it and you can look at length of stay, you can look at the treatment times and what's going to be happening on each day that they should stay in, what things would extend their stay, and then the recovery at home, and so what that would look like. So I like that, and so that when we do teaching to patients, because sometimes we find out they're going to have a hip replacement and then they have diabetes, and so MCG can help us kind of get that patient ready for that surgery and understand what they need to do post-op so that we would avoid any kind of infection, and especially with diabetes, because they have to watch their sugars, and then we have to watch their pain levels, and we don't want to have them a readmission. And so those are the kinds of things that MCG goes into and helps us kind of educate that patient and gives them the checklist, goes both pre and post hospitalization. So we like that. And you can go through that with anything. You can go for cancers, you can go for depressions, you can give them a toolbox. You can open up and talk to them about having a good toolbox on a day that they're feeling bad so that they put that together. So it's very rich in content. I really appreciate that it's updated yearly. I think that, for us, it's something that keeps us current. And so when we're talking to patients about that, we can tell them this is new, and it might be a slight change in a variation that was acceptable a couple years ago, but now it's something that they're doing differently, and helps them understand testing. Like, this is something that MCG does too. Like, these are normal tests that you would see for this process, or for this disease, or for this hip replacement. What things that they should expect to have done, and like a PTINRs and things like that. If they're on a blood thinner, if they're on a medicine that requires that or not, and so it's just. It's just really good. I really appreciate it. And I've been using MCG since I became a case manager. And I want to say that was back in 2010 that I started using MCG. So I've been using it for about a good solid 9 years. I don't like the competitor, so I don't think it offers the same. I think it's very hard to use, and that's why I think MCG is why I chose that for my company when we went to renew our contract. Well, not renew. We didn't renew with the competitor. We went with MCG.